Physiowebseries Knee Complex Season 1. Let's begin with Series 6. In previous series, we saw how patella acts as anatomical pulley and it helps quadriceps to exert more pull on tibia. But this advantage is at a cost. As we know that during the knee extension, to generate the extension torque, patella assists the quadriceps femoris muscle so that there is increased angle of pull of this quadriceps muscle on tibia, causing extension of knee joint forcefully. Now, as the knee joint is approaching to its end range of extension and it is at the end range of extension, and if there is forceful quadriceps contraction at this point, it may cause excessive tibial translation anteriorly, which may be harmful. So to put restraint on this excessive anterior translation of the tibia, we need a structure to hold it at its position and to prevent this excessive anterior translation of tibia, which can be well appreciated in this diagram. As the knee joint is flexed to more than 60 degrees or at least 60 degrees of knee flexion, at that time there is little or there is no tibial translation, anterior translation of tibia. But when it is approaching to the end range of extension, there is risk of anterior translation of tibia excessively. So now, who will come into picture to prevent this? The name of that structure or that passive stabilizer is actually a ligament. Ligament is basically a structure holding two bones together. In this case, the name of this ligament is anterior cruciate ligament. Cruciate means cross. So this anterior cruciate ligament or ACL crosses the PCL. Now our focus is on anterior cruciate ligament. So let's have a look at that. At the orientation and role of ACL. So we know we have femur, we have patella over here, we have tibia, the tibial tuberosity, and in this diagram, as we can see, the ACL can be appreciated. This is the lateral side and this is the medial side. So this will be lateral condyle and this will be medial condyle of femur, and the ACL ligament starts from the posteromedial aspect of lateral femoral condyle and it comes ahead to insert or to end somewhere in front of the intercondylar eminence of tibia. In this right hand side diagram also we can appreciate there is femur and there is quadriceps muscle and there is patella acting as pulley, which has the insertion of quadriceps tendon, but again the patella has patellar tendon inserting on tibial tuberosity, because of which the angle of pull of quadriceps muscle on tibia is increased. So it can cause more of anterior translation of tibia during end range of extension. We saw that just now. So here this ACL ligament, as can be seen in this diagram, this will prevent this excessive anterior translation of tibia. Hence it acts as, or the ACL acts as a passive stabilizer of knee joint. So this is the upper aspect of tibia where we can appreciate the lateral meniscus and the medial meniscus. This is the PCL, and in the front part, this is the front part and this is the back posterior part. So front or anterior part is this where this ACL is going to come and insert. So here is the insertion of ACL in front of the intercondylar eminence of tibia. And this part which is cut will be actually joined to the posteromedial aspect of lateral femoral condyle. So as we discussed, the original insertion of the ACL ligament can be very clearly appreciated over here. So again, this is the lateral side and this is the medial side, and this is the anterior view. So this is the lateral condyle, and from posteromedial aspect of this lateral femoral condyle, there is the origin of this ACL or anterior cruciate ligament. Anterior because it travels anteriorly, can be seen, and then inserting over here in front of the intercondylar eminence of tibia. Hence, what it does is, it will again the same thing, it will prevent the excessive anterior translation of tibia. As we can see, the PCL is attaching somewhere backwards. Hence the name posterior cruciate ligament, and both of these ligaments are forming cross, which is, as I said, hence the name cruciate is given to the ligament. Now focusing on the ACL, as in the lateral view, we can appreciate that this is the anterior side and this is the posterior side, and the ACL is coming this way, from here over here. So in the posterior view can be again appreciated from posteromedial aspect to the front of the intercondylar eminence. It is going to the front. This is the back side where we can see the PCL attaching, whereas the red part is the ACL which is going to the front. Can be seen in the anterior view. This is also the anterior view, which is best appreciated from the posteromedial aspect coming anteriorly over here. Again, now to go into details of ACL, there are two components or two bands or two bundle of ACL ligament. One is the smaller one, which is the anteromedial bundle, and the other one is the larger one, which is posterolateral bundle. So anteromedial and posterolateral bundle, both of them are included in ACL ligament. Now during performing certain movement, that is knee joint, we consider knee flexion and knee extension. So during knee flexion, which bundle gets tighter? The anteromedial bundle. We can appreciate the blue one is anteromedial bundle, which is getting tight during the flexion movement. So here this is the knee flexion going on, where we can see the anteromedial bundle of the ACL ligament is getting tighter, and in knee extension the opposite thing happens, where the posterolateral bundle, which is over here, tightens and the anteromedial will loosen. So what happens if there is injury to this ACL ligament? Now in this case, as you can see, the part of ACL ligament is missing. So if there is injury, there is complete tear or maybe partial tear of ACL ligament, it will not be capable to prevent the anterior translation of tibia. As we know, the quadriceps muscle, and in the center will be the patella acting as pulley and inserting to tibial tuberosity. So this quadriceps muscle has increased angle of pull over tibia, which when the knee is approaching to its end range of extension this way, and at that time if the quadriceps is generating more force of contraction, so that can cause excessive anterior translation of tibia. Now to prevent this excessive translation, we can see ACL is not there. At that time, there will be giving way of knee as explained to you by the patient, where the excessive anterior translation of tibia will not be prevented as there is injury to the ACL ligament. And this, as I said, the patient will explain you while walking or running, the knee gives way or giving way of knee due to absence of ACL ligament. So this is an important clinical aspect to keep in mind. That was quite in detail to focus on ACL, its two bundles, and how it prevents the anterior translation of tibia or the excessive anterior translation of tibia, actually present somewhere in this direction. Hence, ACL is quite crucial in itself. Again, to revise, it is prominent, most important passive stabilizer of knee joint, the anterior cruciate ligament.